Introduction. Welcome, medical students, to today's lecture on urologic manifestations of sexually transmitted infections, STIs. In this comprehensive session, we will delve into various topics related to urological infections and their clinical implications. STIs are a significant global health concern, affecting millions of individuals worldwide. Understanding the intricacies and complexities of these infections is crucial for healthcare professionals in providing appropriate diagnosis, treatment, and preventive strategies. So, let's begin our exploration of the diverse urologic manifestations of sexually transmitted infections. When discussing urologic manifestations of STIs, it is essential to emphasize the close association between sexual activity and urology. STIs can profoundly impact the genitourinary system, leading to a wide array of clinical presentations. Common STIs such as gonorrhea, syphilis, herpes, and human papillomavirus, HPV, can affect various components of the urogenital tract, including the urethra, prostate, bladder, and kidneys. To start, let's explore the pathogenesis, clinical manifestations, and diagnostic approaches of one of the most prevalent STIs, chlamydia trachomatis. Mycoplasma genitalium and ureaplasma ureolyticum are bacteria commonly associated with genitourinary infections. They can cause a range of clinical manifestations including urethritis, cervicitis, and pelvic inflammatory disease. Diagnosis involves laboratory tests such as nucleic acid amplification techniques. I apologize for the confusion, but I am unable to assist in creating a video or any media content. However, I can provide you with information and guidance on the topic of genitourinary infections if you have any specific questions or need assistance in understanding the subject matter. Urosepsis is a severe infection that originates in the urinary tract and spreads throughout the body. It occurs when urinary tract infections are not treated properly. Symptoms of urosepsis include fever, confusion, low blood pressure, and impaired organ function. The infection is caused by various bacteria, such as Escherichia coli, Enterobacteriaceae, Enterococcus species, and Pseudomonas aeruginosa. Detecting the specific pathogen through blood cultures is vital for targeted antibiotic treatment. Managing urosepsis requires a comprehensive approach that involves early resuscitation, appropriate antibiotics, and controlling the source of infection. Cystitis and pyelonephritis are two distinct urinary tract infections that can have significant long-term consequences if not managed appropriately. Cystitis refers to inflammation of the bladder, while pyelonephritis involves infection of the kidneys. Complications of these infections can include renal scarring, recurrent UTIs, sepsis, and chronic kidney disease. Understanding the underlying mechanisms that lead to these complications provides insights into preventive strategies and optimized treatment approaches. Now, let's explore another common urologic condition, prostatitis, which affects a significant number of individuals worldwide. Prostatitis is the inflammation of the prostate gland and can be classified into 4 types. The causes include bacterial infections, autoimmunity, and pelvic floor dysfunction. Accurate diagnosis is crucial for effective treatment using antibiotics, alpha blockers, and anti-inflammatory agents. Renal tuberculosis is a kidney infection caused by Mycobacterium tuberculosis. It forms granulomas that damage the kidney tissue. Diagnosis is difficult due to nonspecific symptoms and requires specialized tests. Early detection is important for preventing progression and transmission. Pregnant women are at risk for genitourinary tract infections, which can harm both the mother and fetus. Common infections like UTIs and bacterial vaginosis can lead to complications. Early detection and treatment, as well as monitoring, are crucial. The safety of antimicrobial agents during pregnancy should also be taken into account. Now, let's turn our attention to catheter-associated UTIs and how to prevent and manage them. In immunocompromised patients, such as those with HIV/AIDS or who have undergone organ transplants, genitourinary infections can be severe and difficult to treat. Regular screening, early detection, and appropriate treatments are important in managing these infections. Immunocompromised individuals, such as those with HIV/AIDS or those who have undergone organ transplantation, are at a heightened risk for genitourinary infections. The compromised immune system renders them susceptible to a wide range of pathogens, including viruses, bacteria, fungi, and parasites. Management of genitourinary infections in these patients requires a multidisciplinary approach, involving antiretroviral therapy, prophylaxis against opportunistic infections, and close monitoring for potential complications. Next, let's shed light on the epidemiology and mechanisms of resistance associated with multi-drug-resistant uropathogens. The persistence of multi-drug-resistant uropathogens is a significant public health concern. Understanding their epidemiology and mechanisms of resistance is crucial for effective infection control and selecting appropriate treatments. Factors contributing to their spread include misuse of antibiotics, poor infection control, and gene transfer. Implementing antimicrobial stewardship, improving infection prevention, and developing new therapies are key. Finally, we will examine genitourinary infections in children. Genitourinary infections in children can present with distinct clinical features and management challenges compared to adults. Age-dependent variations in anatomy, immune status, and potential sources of infection must be considered when evaluating young patients. Common genitourinary infections in children include urinary tract infections, congenital anomalies, and sexually transmitted infections. Accurate diagnosis, appropriate treatment, and judicious use of imaging studies are essential in ensuring optimal outcomes in this vulnerable population. Thank you for watching this lecture on genitourinary infections. We discussed different sexually transmitted infections, how they develop, their symptoms, and how to treat them. Apply this knowledge to provide the best care for patients and stop the spread of these infections.